My name is Melissa Clark, and today I'll be conducting my head-to-toe video for my health assessment class from Maryville University. This is Joel. He is my patient for the day. Prior to coming in, I asked him to get into comfortable clothing. I asked him to empty his bladder. We got a full set of vital signs, including height and weight. And we checked his visual acuity using the Snellen chart for distance and the Rosenbaum chart for near vision. That was checking his cranial nerve number 2. As he came into the room, I watched him ambulate. He had a steady gait. He had no ataxia whatsoever. He was well nourished, well muscled, and he was well groomed. He also conducted conversation with me, and he's totally alert and oriented. First, I will check his head, make sure it is normal cephalic, there's no masses, no specific indentions. I'm going to palpate, see if I can appreciate any masses. I do not, no abnormal feeling. And his hair, it is well distributed, healthy, attached to the scalp. I don't find any areas of alopecia, no scaling or nits. I'm going to then check his face. His skin is symmetrical without any areas of lesions. I'm going to palpate his face, make sure that there's no masses in his face. But while I'm doing this, I am going to check his sinuses, his frontal and maxillary for any tenderness. I'm also going to check his jaw for temporomandibular dysfunction. Can you open your mouth, please? Close. Thank you. And there was no popping or clicking with that. To check his facial sensitivities, I'm going to check. Tell me if you feel this.
I feel it. Feel it. Feel it. Feel it.
Okay. Now, while we're checking the cranial nerves, can you go ahead and clench your teeth, smile, puff out your cheeks, squint your eyes, wrinkle your forehead, stick your tongue out, and move it from side to side and up and down. Okay, and that was checking more of his cranial nerves. Next, I'm going to go on to your eyes. His eyebrows are full, they are evenly distributed, no areas of scabbing in them. His eyelashes extend outward from his face. Sclera is white and clear. Conjunctiva is pink and moist. There's no exudate there. I'm going to palpate his lacrimal ducts. No exudate, no excess tearing in those. Next, I am going to look for direct and consensual. Make sure that he is equal, round, and reactive to light, and convergence. And he did fine with all of those. We're going to do the uncover and cover test on his eyes. Can you please cover one of your eyes? And now the other one. And in that, I was looking for any involuntary motion of his eyes or any nystagmus, which he had none of. Next, we are going to do the confrontation test, and this tests for peripheral vision. Can you cover one of your eyes, please? I'll do the same. And tell me when you see my fingers.
I see it. I see them.
And now our other one.
I see it. I see it.
Okay. And that was just to check his peripheral vision. Next, I will go on and check his eyes. I am going to check for the red reflex. Start with 0. I check his right eye with my right eye. And his left eye with my left eye. Excellent. We're going to do the cardinal fields of gaze next, and this is going to check his cranial nerves number 3, 4, and 6. Now, if you can look straight ahead, and then follow my pen light, but don't move your head, just move your eyes. Okay, that was excellent. That was checking his cardinal fields of gaze. Next, we'll move on to his ears. I'm going to begin by inspecting them. They are even on his face. The skin is even, contiguous with his face. And I don't see any kind of masses. I don't palpate any masses, and I don't see any obvious exudate coming from his ears. I will then look into his ears. I'll be checking the canal for excess cerumen, and I will be checking the tympanic membrane. I'll be looking for bulging, redness, any exudate. This should not be there. Canal is clear, pulling up and back on his auricle, and he has no bulging, no exudate, and no excess redness. His bones are all visualized as well, and I would do that on both sides. Next, we're going to do a whisper test. You can cover one of your ears, please, and this is going to check his auditory function. I'm going to whisper a word, and you repeat it, okay?
Baseball.
Okay, cover your other ear, please. We'll come to your other side.
Grapefruit.
Very good. And he repeated the words back accurately. Next, we'll move on to his nose. First, I'm going to look at his nose visually. It is even, it is midline in his face. I'm going to palpate it for tenderness, any nodules that shouldn't be there. I'm going to look inside. I'm looking for his septum. It's midline, no deviation, and no sores, any abnormal exudate in there. His turbinates are visualized, and they are the same color as the rest of the inside of his nose. Now I'm going to check for patency. Can you cover one side of your nose, please? And now the other. And he's able to breathe out of either side, which is excellent. Next, we'll move on to his mouth. I visualize his lips. They're full, they're moist. There's no lesions on the exterior of them. Can you open your mouth for me, please? I'm going to look at your teeth. They are all good. They are well adhered to his gums. They're pearly white, no obvious cavities in them. As I look at his tongue, the ventral side is moist. His frenulum is visible and attached to the bottom of his mouth. Top of his tongue is also slightly roughened. No leukoplakia, no lesions. Open up wider, please. I can visualize his uvula. It's midline. It goes up and down as he swallows. Posterior and anterior pillars are visible. Tonsils are grade 1, which is normal. And the roof of his mouth, the hard palate and the soft palate are continuous and intact. Don't yawn. I guess that's a normal reflex. I also want to go ahead and check cranial nerves 9 and 10 while we're here. So I'm going to have it open, say ah, and gag. And he passed both those fine, so those cranial nerves are intact. Next, we're going to look at his neck. First of all, when I visualize it, it is upright. It is midline in his head. I don't see any obvious bulges, no jugular venous distension that's pulsing out, and I don't see any goiters. I'm going to palpate your neck. Make sure that there's no lesions, no swollen parts. And I'd like to check your range of motion. Can you put your chin down to your chest, please? And then back. Ear to this shoulder. Ear to that shoulder. Excellent. And then shrug your shoulders. And that checks out a cranial nerve number 11. On your neck, I am going to check both carotids, one at a time. I'm going to check the trachea, make sure that it's midline. And can you swallow for me? His thyroid moves smoothly when he swallows. And I'm able to manipulate it in his neck. Next, I'm going to actually listen to his thyroid and his carotids. Carotids, can you hold your breath, please? And typically, I would use the bell of a stethoscope to do these. And the thyroid. I'm also taking for bruits. There are no bruits present in that at all. Next, I'm going to go and check his lymph nodes. I want to make sure that there's no lymphadenopathy. I'm going to start with your occipital, posterior auricle, preauricle, tonsillar, submandibular, submental, and lingual. And we're going to go on to the anterior cervical, the posterior cervical, the supraclavicular, and the infraclavicular. You need to head to one side, please. And I'll do the deep cervical there. And then we'll do the arms out, and we'll do the axillary. I did not note any edema to any of his lymph nodes in that respect. Next, if you can, look at your arms while we're here. The skin is warm. It is well colored. It's even all the way down, and he is well muscled. I get to his fingers. I see no clubbing, no cyanosis. capillary refill is less than 3, and his fingernails are well attached to the bed of the nails. I can check your pulses, brachial and radial, and I would do that bilaterally, and they are fine. If you wouldn't mind turning with your back to me, I'm going to check your back. First, I visualize it to make sure that respirations are even. They're unlabored. He's not using any accessory muscles here. And then I am going to palpate. I'm just going to touch all the way down to make sure that I don't feel any masses that shouldn't be there. Nothing that is worrisome. Spine looks good. And then we're going to percuss. I'm going to percuss bilaterally. And this just tells the difference between the lung mass, the lung areas versus the organs. And I'm going to check for costal vertebral tenderness. Please let me know if this hurts. And that seemed fine. I would then look at his spine while he's there because he's nice and thin, and I can actually visualize his spine, and it looks like it is straight and in a line. We're going to oscillate his lung fields bilaterally. Breathe in and out for me. In and out. In and out. In and out. In and out. And in and out. There was no adventitious breath sounds, no wheezing, no coarseness, and I'm going to check now for tactile fremitus. Say 99.
99, 99, 99.
And that's checking for any consolidation, any kind of masses, and everything checked out fine there as well. I'm going to do the same thing on his lateral sides. His AP diameter is greater than his lateral diameter, which is normal. I'm going to auscultate his lateral sides. Breathe in and out for me. In and out. In and out. One more time. Okay, and that all sounds good. Next, I check for diaphragmatic excursion. I am going to have you breathe in as far as you can. And I'm going to percuss until I don't hear. Okay. Now breathe out. Take a breath and breathe out as hard as you can. And I'm going to go up from there. Would mark that with a pen typically. And measure the difference. It should be between 3 and 5 centimeters, which it is, so that is absolutely normal. Next, if you'd like to turn back around for me, please. We're going to do the same thing on the anterior chest. I am looking for any kind of heaving, any pulsations, anything abnormal, which I do not visualize. Next, I'm going to palpate. I'm going to see if I feel any masses. While I'm doing that, I am watching his respiratory status to see if he has any dyspnea, using any kind of accessory muscles. And again, he's not. I don't appreciate any masses while I'm doing that. I'm going to percuss. I am going to check to palpate for any bruise or thrills, and then check 5th intercostal space for his PMI. That's very easily found with him. I'm going to auscultate his heart tones first. Start by his aorta, pulmonic, Erb's point, tricuspid, and mitral, and everything sounds good. Next, I will auscultate his lung fields. Breathe in and out, 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 in and out. Thank you. And again, there's no adventitious breath sounds whatsoever. If you can lie down for me, please. As he lies down, I visualize his abdomen. I look for any abnormalities in his muscle structure, any ventral hernias, and I visualize none of that. And I'm going to check his contour of his abdomen. Contour looks good. I don't see any obvious excess peristalsis, no heaving, no pulsations in his abdomen. I am going to lightly palpate throughout. Oh, I'm sorry. First, I'm going to auscultate his bowel sounds, all 4 quadrants for 3 to 5 seconds. Make sure that his bowel sounds are present and normoactive. I'm also going to auscultate his aorta, renal arteries, iliacs, and femoral arteries. I'm going to go ahead and palpate for his aorta as well. Next, I will percuss. And this is finding the difference between the hollow and the solid organs in his abdomen. I'm going to do a light palpation just to make sure there's no areas of great amounts of tenderness, no masses, none of that. And then a little deeper palpation. Again, palpating for the organs and for any masses. That's negative. Next, I am going to palpate for his liver, borders, solid. You can percuss for those as well. That way I can get a good feel for the size of his liver. And it's usually 6 to 12 centimeters. You can lay on your side for a minute, please. I'm going to attempt to palpate his spleen. Typically his spleen will not be palpable, which it is not. And I'll go ahead and try to palpate his kidneys. Okay, back on your back. And the other kidney. Those also are not palpable at this time, which is a normal finding. Okay, sir, if you can go ahead and sit up for me, please. The abdomen was absolutely negative. Next, we're going to go on to the lower extremities. I look at color on his legs. They are both good. Again, his feet, there's no cyanosis in his feet. Toenails are good. They are well attached. And they have less than 3-second refill on capillaries. I'm going to assess for his popliteal arteries. Those pulses are good. Dorsalis pedis are good, as well as the popliteal. I'm sorry, the popliteal, posterior tibials. That all checks out well. I'm going to check the reflexes in his legs using the hammer. They're even. And then with his Achilles. I'm also going to go ahead and do the reflexes in his arms. And everything seems to check out fine. If you can stand up for 1 second, please. I'm going to go ahead and check his musculoskeletal system. You can please bend over and touch toes. I'm going to look at his spine, make sure the curvature is fine. Make sure that he is flexible enough to cut. Look at the curvature of the cervical, the thoracic, and the lumbar. Up, please. And then do a full squat for me. This is going to evaluate his flexibility. Up, please. As well as his balance. And that concludes our physical exam for today.